what's most indicated for this patient at this time, thinking that she has moderate to severe AR and severe mitral stenosis. The most indicated intervention would probably be aortic valve replacement and open mitral valve repair. So then we started to think about, is that possible for this patient? You know, we're getting a bill of 200,000 rupees to go forward with this procedure. That's something that's not even in the realm of possibility for the patient. You know, we're thinking about, can we transfer this patient to somewhere where they could do this procedure for free? Are there government funds that could pay for this procedure? And we decided to then look into the literature a bit more to see if there's any guidance in terms of how best to treat this patient. So one of the first papers we looked at was a case series of PMDD in patients with and without aortic regurgitation. So they had 53 patients with rheumatic mitral stenosis and associated mild or moderate AR. And they compared those to 112 patients without AR. And for the patients with mild to moderate AR, they had similar results to the patients without AR. So as you can see, Group A is the patients with a mild or moderate AR, and Group B is the patients without. So 27 patients in the group with mild to moderate AR came in with class 3 symptoms. And after the intervention, none of them had class 3 symptoms anymore. 48 only had class 1, and 5 had class 2. And then at follow-up, which was a median of about 40 months away, so quite a long ways away, still the vast majority of the patients were NYHA class 1. So out of 58 patients with severe mitral stenosis and mild or moderate AR who only underwent balloon, is it valvotomy, is that the word? We'll say PMVV. So out of those 58 patients, 47 of them were NYHA class 1 at about 40 months of follow-up. So pretty impressive results. And these are, nothing was done to the aortic valve in these patients. So now we know that patients with mitral stenosis and mild to moderate AR benefit from PMVV and do fairly well. But the echo that we got has been read as moderate to severe. So do we stop there and do we trust the echo we've been given, or do we, you know, dig a little further and try to figure it out for ourselves? So, you know, we looked a little bit into what the criteria are. Sorry, this slide is a little bit hard to read. What the criteria are for severe AR. And a couple of the things that make the difference between moderate and severe AR include the central jet, so the regurgitant jet into the LVOT. What percent width of the LVOT is that jet? And this will make more sense with the video that I'll show you in a second. And the other thing is the width of the narrowest point of that jet. So if you look at the regurgitant jet, so basically the blood flowing back from the aorta into the left ventricle. If you look at the narrowest point of that jet, how wide is it? And those two things help you distinguish, are two of the primary things that help you distinguish between moderate and severe AR. So we just assumed that the outside echo had performed these things, but of course they weren't documented and may not have been performed. So here's the echo that we did.